When you think of surgery, what pops into your head? Probably a super clean, brightly lit operating room, right? Well, there is a whole other world of surgery, one that happens at the absolute edge of what's possible, where pretty much every rule you thought you knew gets tossed right out the window. This is where we find a totally different rulebook, the War Surgery Code. Okay, so to really get this, you've got to understand that we're talking about two completely different universes. On one side, you have civilian surgery. It's a world of perfection with teams of specialists, pretty much endless resources, and the incredible luxury of time. And on the other side, well, you have war. It's just chaos, scarcity, a brutal, bare-bones environment where the one and only goal is to keep someone breathing for one more hour. You see, in a regular hospital, a surgeon's mission is to put the body back together as perfectly as possible. It's all about meticulous repair, making sure things look right, and ensuring long-term function. It's a world that's built on having total control and precision. But in a war zone, or really any mass casualty event, that entire way of thinking just shatters into a million pieces. The resources, they're violently ripped away. That calm, controlled room, it evaporates. A whole new reality takes its place, and it's governed by its own set of absolutely unforgiving laws. And this is really the key. Dr. Atef Ahmed, who literally wrote the book on this, just nails it with his quote. He says, "War surgery is not civilian surgery performed in a dangerous place. It is a fundamentally different discipline. It's not just about changing your location. You have to change your entire philosophy. It's a whole new ballgame." So out of all this chaos, a new code emerges. This isn't something you find in your standard medical textbooks. Nope. This code is written in blood. It's forged by the brutal realities of physics, how the body reacts to insane trauma, and the logistical nightmare of working in a disaster zone. And what's the prime directive of this new code? Well, it's this simple, brutal equation. This is the heart and soul of triage. It's not about giving one person a perfect outcome. It's about doing the greatest good for the greatest number of people with the very limited stuff you have, right this second. Now, the biggest enemy in combat trauma isn't the bullet or the blast itself. It's what happens after. It's a physiological collapse known as the lethal triad. Think of it as a catastrophic, self-fueling downward spiral, and pretty much every single action in war surgery is designed to stop it from spinning out of control. Let's break it down. First up, hypothermia. A patient who's bleeding that much simply can't regulate their own body temperature. They become dangerously cold, even if it's hot outside. And that cold just makes everything else a whole lot worse. Second, acidosis. So as all that blood is lost, the body's tissues are starved of oxygen. They flip into this emergency metabolism mode, which pumps out massive amounts of acid. The blood itself becomes acidic, and the body's critical chemical reactions just start to fail. And finally, the last piece of this deadly puzzle, coagulopathy. Here's the kicker. Cold, acidic blood loses its ability to clot. It just won't work. So the one thing the body desperately needs to do, stop the bleeding, it can't. And this, of course, causes even more bleeding, which makes the patient colder and more acidic, and the whole deadly spiral just spins faster and faster until it becomes unstoppable. So how in the world do you fight the lethal triad? Well, you use the cheat codes of war surgery. These are fast, decisive, and, yeah, sometimes brutal techniques that shortcut the problem and focus on one thing and one thing only: physiological survival. The main strategy is called damage control surgery. The idea is simple. Speed, not perfection. You get in, you stop the massive bleeding any way you can. Often that just means packing the wound, and you get out. That's it. You're not there to fix the organs. You're not doing any fancy repairs. You just stop the bleeding, then retreat to the ICU to get the patient warm and get their body chemistry stable before you even think about going back in for a proper fix, sometimes days later. And the specific tools are just as direct and to the point. You've got pelvic binders that basically slam a fractured pelvis shut to stop internal bleeding. You've got shunts that act as a temporary bypass for a destroyed artery. And yes, rapid amputations. It's all about the unapologetic prioritization of life over limb, because a lost limb is always better than a lost life. I mean, just look at these tools. They're not designed for some complex, delicate reconstruction. They are made for one thing: controlling hemorrhage. They're for survival. Every single item in this kit is built with a single purpose in mind: to stop that lethal triad and buy time. The goal is simply to keep the body's core systems from completely collapsing. But don't make the mistake of thinking this is just for military medics. Not at all. The principles of the War Surgery Code are absolutely critical for any mass casualty event. A natural disaster, a major highway accident, a terrorist attack. These are the lessons for when your hospital is suddenly overwhelmed and everything you need is suddenly scarce. And this really brings us to a final, pretty chilling takeaway. This isn't the kind of knowledge you can just look up when things get crazy. When the worst happens, when the trauma bay is pure chaos and the blood supply is running low, there is no time. This code has to be an instinct. You have to know it like you know your own pulse. So it leaves you with this really powerful question, doesn't it? These principles weren't dreamed up in a lab. They were written in blood over the last 100 years of conflict and disaster. They represent that razor's edge between life and death. So when the worst inevitably happens again, who knows the code?